Child with special needs. In this, today we are going to deal with the lesson Speech and Language Disorders. The objective of this lesson is to impart knowledge on basic issues concerning speech and language disorder. They are the classification or types, the characteristics or symptoms, etiology or the causes. The second objective is planning developmental intervention programs for children with speech and language disorder. For this, knowledge about the diagnosis, treatment, management and therapies is very much needed. Communication disorder is a speech and language disorder which refers to the problems in communication and in related areas like oral communication, oral motor function. A communication disorder may also occur in language, speech or hearing. Language difficulties include spoken language, reading or writing. Speech encompasses such areas as articulation and phonology. With early intervention, the children with speech and language disorders can be helped in educational performance. Parents are often concerned about their child's speech and language development when they do not seem to be talking like other children of the same age group. Difficulties with spoken language may lead to frustration, and this could consequently reflect on the child's behavior and learning. Knowledge of what is normal speech and language development can help the parents figure out if they should be concerned and whether they should refer their children to speech language pathologist. Now, let us try to define what is speech and language disorder. Speech or language impairment means a communication disorder such as stuttering, impaired articulation, a language impairment or voice impairment that adversely affects a child's educational performance. Language impairment. A significant deficiency not consistent with the student's chronicle age in one or more of the following areas. A deficiency in receptive language skills or to gain information. A deficiency in expressive language skills, that is to communicate information. A deficiency in processing auditory perception skills, that is organizing information. Articulation impairment. A significant deficiency in ability to produce sounds in conversational speech not consistent with chronicle age. Voice impairment. An excess or significant deficiency in pitch, intensity or quality resulting from pathological conditions or inappropriate use of voice mechanism. Fluency impairment. Abnormal interruption in the flow of speech by repetitions or prolongation of a sound, syllable or by avoidance and struggle behaviors. These are the different types of speech and language disorders. From the age group 1 to 2 years, these are the possible signs or symptoms of speech and language disorder if they are not responding to sound or vocalizing. There is no use of gestures such as pointing or saying bye bye. They prefer gestures over vocalization to communicate by 18 months. They find difficulty with imitating sounds by 18 months. If the child is of over 2 years of age, then what can be the possible warning signs? They are, they imitate speech or actions and they does not produce words or phrases spontaneously. They say only certain sounds or words repeatedly and cannot use spoken language to communicate more than his or her immediate needs, and they cannot follow simple directions. The American Speech Language Hearing Association lists a number of characteristics to be aware when dealing with young children. One or more of these characteristics may occur in children who are affected with language disabilities or developmental language delays. They are failure to understand or attention to rules of conversation, difficulty using different languages for different needs of the listener or situation, incorrect use of grammar, poor or limited vocabulary, difficulty requesting further information to aid understanding, tendency to agree rather than voice opposition, indirect request and ambiguous statements. They have this class clown behavior. They have extreme forgetfulness. They also face difficulty in understanding non-verbal behavior like the body language. They have difficulty finding words. They have difficulty understanding riddles, jokes and sarcastic remarks. They have difficulty with instructions, especially those that are long and grammatically complex. They have difficulty with the words with multiple meanings. They have difficulty in sequencing the words. They have difficulty in expression of thoughts. They have difficulty in organizing information. These are some of the characteristics or signs of speech and language disordered children. Speech disorder refers to difficulties producing speech sounds or problems with voice quality. The difficulties faced by the children with speech disorders include difficulty in speech production. Types of speech impairment. There are basically 3 types of speech impairment. They are fluency disorders, articulation disorders and voice disorders. Fluency disorders. Fluency disorders, commonly known as stuttering, are characterized by abnormal interruptions in the form of hesitations, repetitions or prolongations. It is a disruption in the normal flow of rhythmic speech. Articulation disorders. Articulation disorder interferes with communication because of abnormal production of speech sounds. The abnormal productions include substituting one English phoneme for another, distortion of standard sound, omission of sound that should be present and addition of sound that should not be present. Articulation disorder occurs when a person cannot correctly pronounce one or more sounds. This may occur as a result of delayed development, poor muscle control, cleft lip or palate, hearing impairment or learning disabilities. Error of many sounds that form a pattern is called phonological disorders. Voice disorders is abnormality of voice quality, pitch or loudness. A person's voice can have a harsh, hoarse or nasal quality or breathy quality. The pitch of a voice can be too high or too low or too monotonous. These qualities may call unwanted attention to an individual because of the way his voice sounds. Voice disorder may result from damage to vocal cords during surgery, misuse of voice like over-yelling or singing which is excessive. The following characteristics may indicate that the child is experiencing problem in the area of voice if the child has. If he produces a pitch that is too high or too low, if he sounds hyponasal like the way we sound when we have cold, or if he has a harsh, hoarse or breathy sounding voice, or if he uses inappropriate volume when speaking, and if he talks through his nose, hypernasal condition. Fluency disorders. Let us see the different types of fluency disorders. The fluency disorders are characterized by hesitation, repetitions, prolongation of a sound, syllable or word or phrase. Stuttering. Rapid fire repetitions of a consonant or vowel sound, especially at the beginning of the words, prolongation, hesitation, interjections, and complete verbal blocks. This is a disorder wherein the person repeats the first half of the word or prolongs the word or the syllables or gives involuntary pauses in between the words. It can be both a developmental delay or acquired condition. The next disorder of fluency is cluttering. Excessively fast and jerky speech. Cluttering speech disorder affects the fluency of speech. It occurs because the person speaks very fast and repeats things many a time to make it comprehensible. There is no distinct cause for cluttering. It may occur because of drug abuse or prolonged illness. Dysarthria. It is commonly known as slurred speech. The speech is slow or inaccurate. It is generally caused by a stroke or brain tumor. This leaves the muscle in the mouth or tongue weak, paralyzed, and it becomes difficult to control them. Lisps. This is known as stigmatism. This occurs when the person is unable to produce a specific sound. It is of three types. Interdental. This occurs when the tongue comes in between the teeth at the time of speech. Lateral. A wet sound is produced because of the air spaces from the sides of the tongue. Palatal. This happens when the midsection of the tongue touches the soft palate. Dysprosody. This is a rare speech disorder. Here, the rhythm, the modulation, the timing and intensity of the speech is disrupted. Sometimes is also referred to as a foreign accent syndrome. Its causes have not been fully understood. It may be a result of Parkinson's disease or tumor or a stroke that affects the brain. The following characteristics may indicate that the child is facing difficulty with fluency. If the child repeats the sound, syllable or words, if he hesitates or blocks when speaking, he inserts sounds or fillers such as ha, etc., prolongs the sound within the words, he exhibits frustration, embarrassment when speaking. The children who present with any kind of these characteristics should be referred to a speech language pathologist. Voice disorders. These are the problems with the quality or use of one's voice resulting from disorders in larynx. The voice disorders are characterized by abnormal production, absence of vocal quality, pitchiness, loudness, resonance and duration. Vocal quality, phonation, that is production of sound. Breathness, hoarseness, huskiness, all these are due to failure of vocal cords. The correct vibrations in the airflow because of the small growth structures which are called the nodules or notes, irregularity or paralysis of any one of the vocal cords, or when too much air will escape and predominate over phonation resulting in huskiness. Resonance, that can be denasal or nasal resonance. Vocal intensity, that is the loudness and softness and the vocal pitch. These are the different types of voice disorders. Language disorder is the inability to understand or use words in context both verbally and non-verbally. Language impairment is significant deficiency not consistent with the student's chronological age in one or the following areas: deficiency in receptive language, skills to gain information; deficiency in expressive language, skills in communicating information; deficiency in processing skills to organize information. The significant difficulties faced by the children in language disorder are as follows. Language production. Communicating a message with words or syllables or signs from our memory and following the rules of combining them and using them in particular context. Language processing. Understanding a message after it has been received by recognizing the concepts, ideas and the words or syllables or signs used. Language use. This refers to producing language that is appropriate to the context and also interpreting the language according to the context. The types of language impairments are phonological disorders, morphological disorders, semantic disorder, syntactical deficits and pragmatic difficulties. Phonological disorders. Phonological disorders are defined as abnormal organization of the phonological system or significant deficit in speech production or perception. A child with phonological disorder may be described as hard to understand or not saying the sounds correctly. Morphological disorders. Morphological disorders are defined as difficulties with morphological inflections, inflections of noun, verb, adjectives and the signals different meanings of different words. Semantic disorders. They are characterized by poor vocabulary development or inability to comprehend the word meanings. Syntactic deficits. They are characterized by difficulty in acquiring the rules that govern the words and other aspects of grammar. Pragmatic difficulties. They are characterized as problems in understanding and using language in different social contexts. These are the different types of language impairment. Receptive language disorder means the child has difficulty understanding what is said to them. The symptoms vary between the individuals. Generally, the problems with language comprehension usually begins before the age of 4 years. The other name for receptive language disorder include central auditory processing disorder, comprehension deficit. The treatment option include the speech and language therapy. The characteristics that indicate the child is having receptive language disorders are: the child has inadequate attention span, particularly during the oral presentation. He has poor listening skills, difficulty following the directions, poor memory for the information presented verbally, difficulty categorizing related words or concepts, difficulty understanding figurative language, and difficulty with concept of space and time. The treatment options for a receptive language disorder include speech and language therapy, special education classes at school, referring to a mental health service for treatment. A child with receptive language disorder may also have the expressive language disorder, which means they have difficulty with using the spoken language. The characteristics of expressive language disorder are: he speaks in words, phrases which are incomplete and inaccurate sentences. He relies more upon gestures to supplement or substitute for oral language. Uses pronouns plurals incorrectly. He has difficulty with agreement of subjects and verbs. He has difficulty telling a story or describing an event. He has limited expressive vocabulary. These are some of the characteristics in a receptive language disordered child who also experiences expressive language disorder. A speech language pathologist is a professional who evaluates and treats children with speech and language difficulties. A referral with a speech language therapist is often required for initial evaluation, and he also completes a formal test to record and quantify errors for comparison to the child's age groups. An examination of the child's oral sentences and hearing may also be included in evaluation. If the speech language pathologist determines a child has a disorder, he or she may be recommended the speech therapy. Evaluation of language impairment. A significant deficiency in language shall be determined by analysis of receptive, expressive and composite test score that falls at least 1.5 standard deviations below the mean language assessment instruments administered. A minimum of 2 measures shall be used, including criteria referenced or normal reference instruments, functional communication analysis and language samples. Evaluation of language abilities. These include hearing screening, receptive language, vocabulary and syntax morphology, expressive language, that is the mean length of utterance, syntax, semantics, pragmatics and morphology. Evaluation of articulation impairment. A significant deficiency in articulation shall be determined by articulation errors persisting 1 year and beyond the highest age when 85% of the children have acquired the language. Evaluation of voice impairment. Evaluation of vocal characteristics shall include hearing screening, examination by an otolaryngologist, oral peripheral examination, documentation including observation, assessment of how voice impairment adversely impacts his or her educational performance. Now, let us see the evaluation of fluency impairment. Evaluation of fluency shall include the hearing screening, information obtained from the parents, students and teachers, oral peripheral examination, documentation which includes observation, assessment of how fluency impairment is adversely affecting the child's educational performance. The treatment for a child with speech and language disorder may target specific sounds or sound patterns or language to improve overall intelligibility. The treatment may include demonstration of correct sounds, words and training the child to recognize errors and practicing correct speech. The speech and language pathologist should work closely with the child's caregivers to assist with generalization of therapy goals outside the therapy session. Tips for speech and language disorders. Teach the words and concepts through use of actual objects and progress from concrete to abstract. Consistently check the understanding. Seat the child in a position that facilitates the use of prompts, cues and strategies. Before initiating a conversation, it is important to ensure that the student's attention has been secured. Use a slow speech rate if necessary, as this facilitates the processing of information. Use of pictures or photograph to reinforce and review the vocabulary that has been taught. An understanding of sentences is difficult for the students and often present in the classroom with difficulties in following instruction and poor oral comprehension. So, give simple directions in sentences. These are some of the tips for a language disordered child. Now, let us see the ways to enrich language. They are play activities. Some play activities lend themselves to enhanced language interactions like games, dramatic play, block play, songs, stories can all be the focal points. with the adult being the catalyst for productive communication. Self-care activity. For example, waiting in a line to use a sink or bathroom is perfect opportunity to enrich language. Telling stories, making up rhyming words, singing the alphabet song while you count your fingers or toes. This also helps in language improvement. Eating activities. So much of conversation can happen around an eating activity. Sitting around the table with the children while the teacher cuts an orange or an apple and divides the portion can be powerful language stimuli. Conversation about the size, the shapes, colors, food, any number of topics can become a natural topics of conversation. Classroom activities. Reading books, stories, making rhymes, singing songs, having children make up their own stories, write books which are not new activities, but they certainly promote the language and speech. Use of self-talk. Talk about what you do as you do, like a television chef who describes every step of cooking process for the audience. Use language enrichment. Listen, expand and model and what each child says. Do not make corrections directly, but incorporate the corrections into your response. These are some of the ways to enrich the language conversation in a classroom. So, today we try to understand the concept of speech and language disorder, which is a communication disorder. Then we went to see what are the warning signs and possible characteristic symptoms in a communication disordered child. Then we try to understand what are the different types of speech and language disorders. After that, we have seen how to evaluate and the tips for treatment of a speech and language disordered child. At the end, we also try to understand the ways of enriching a classroom environment with conversation topics. Hope you have understood the lesson and enjoyed it. Thank you.